Okay, so let's get right into it. We've talked about that old era of closed wards and institutional thinking, but here in British Columbia today, the model is completely different. The whole goal now is for people to live in the community, not apart from it. So the big question we're tackling here is a really important one. Why did the province change course so drastically, and what exactly did they build to replace the old system?
I mean, this was a huge shift. We went from a system that was defined by locked doors to one that's all about front porches, from isolation and control to inclusion and community. But look, this wasn't just some simple upgrade, it was a complete revolution in thinking, in policy, and in human rights. So, how did we actually get from the left side of the screen to the right?
Well, the first thing to understand is that the system didn't just kind of modernize over time. No, it was forced to change because the old institutional model had some really deep, serious problems. I mean, problems you just couldn't ignore anymore. Behind those closed doors, the old model often created the perfect conditions for serious harm. And we're not talking about isolated incidents that nobody saw. For a lot of people, this was a recurring and totally unacceptable reality.
At the very same time, a powerful new force was growing, the disability rights movement. And its core demand was simple, but it was absolutely revolutionary. People are citizens, not patients you just place somewhere. They have a right, an inherent right, to dignity and a life beyond the walls of an institution.
So you had this combination of things happening all at once. Families, advocates, and a public that was finally becoming more aware. They just could no longer accept the way things were. The pressure for real change became immense. And you can see right here how all that pressure started to create real-world possibilities. As legal rights got stronger in Canada, the expectations for equality grew right along with them. And this is the key part. Real, practical alternatives started to pop up. Things like inclusive education, community programs, smaller homes. They all showed that another way wasn't just possible, it was actually better. The path forward started to become clear. You build support around the person, not around the institution.
Okay, so if you're going to dismantle a system that's been around for a century, what do you replace it with? Well, the answer in British Columbia was to build a totally new community-based model piece by piece over a couple of decades.
This new model was really built on three critical milestones. First, in 1996, the last of the big facilities for people with intellectual disabilities finally closed. That was a historic step. Then, in 1998, mental health policy shifted too, moving resources into regional, community-based services, with the idea of being closer to home. And finally, in 2005, the modern architecture was locked in with the creation of Community Living BC. And this, right here, was the fundamental test. I mean, closing a building is one thing, but can you actually replace it with a living, breathing network of support that works for thousands of different people? That's a huge challenge, not just logistically, but morally too. So, the crucial point is that Community Living BC, or CLBC, was created to be the answer to that very challenge. It became the new central hub, a Crown agency, which basically means an organization operating at arm's length from the government that was designed to manage and fund all these community supports through a whole network of service providers. But this wasn't just about moving boxes around on an org chart. It was a philosophical shift. The big promise was individualization, tailoring support to a person's specific needs instead of trying to fit a person into a pre-existing institutional box. And that led to a whole new set of tools. As you can see here, things like home sharing, supported living, and employment support, they all became the new building blocks for this more person-centered approach. But here's where we have to be really balanced and honest. Because every major reform, no matter how necessary it is, creates new and often unexpected challenges. You can solve one big problem and accidentally create a whole new one. Think about it this way. When you have support that's distributed across a bunch of different organizations, health, social supports, services for kids, services for adults, the real risk shifts. The new point of failure often happens right at the seam. That place where one system is supposed to hand off to another. And the result is gaps. The most famous example of this is the transition from youth to adult services. For families going through it, it can feel less like a smooth handoff and more like falling right off a cliff. School ends, the eligibility rules all change, and that continuous support they relied on can suddenly just disappear. And that leads us directly to the next critical question. In a system that's spread out like this, when something goes wrong in those gaps, who is ultimately accountable for making it right? Now, of course, governments create protocols and coordination agreements to try and solve this, and those documents are important. But for a family in the middle of a crisis, accountability can feel blurry, or it can even seem to dissolve completely. This isn't just a policy issue, it becomes a real, lived experience in those moments of urgent need.
Which brings us to our final and maybe the most important point of all. How do we really measure the success of this massive, massive shift from institutions to community?
And this is the real-life test. A system's true quality isn't found in its annual reports or its policy manuals. It's tested in a moment of crisis, at home, late at night, when a family needs help and has to ask that one simple question: who takes the next step right now?
So that's the journey we've been on. From locked doors, a change driven by pressure over scandals and rights, to a new community model built around the individual. But as we've seen, it's also a model that created new risks around gaps and accountability.
Which leaves us with this final, forward-looking question. What does this system actually deliver when it's put to the test, at home on a real night? In our next explainer, we're going to move from the system's history to its actual performance, looking at quality, at complaints, and how support is really measured when life gets urgent.